It's not the first time I've been told to move to the left, but I didn't expect it to happen at a Tony Blair conference.
Okay, that's the gag of the day. Nicely done.
No, the first gag of the day was telling Tony to his face that unfortunately he's now only my second favourite Labour Prime Minister.
Who's your first? Harold Wilson?
No, obviously it's the Prime Minister that gave me the honour of being Secretary of State for Health and Social Care and did what many thought was impossible and took Labour from its worst defeat since 1935 to the thumping majority and mandate that we secured last week. Of course, Tony is now my joint second favourite Prime Minister alongside Gordon Brown. That's the right thing to say.
I mean, look, if health doesn't work out, there's a career for you at the Foreign Office because diplomacy is clearly quite a skill there. Should we crack on with the interview?
Yeah.
How's it going?
It's good. It's a challenge, and already, I mean, just thinking back to what Tony was saying at the end about the challenge of government, already you can feel the pressure between the immediate, the urgent, especially in the Department of Health and Social Care, but it applies right across the burning deck that the last Conservative government left. There are the immediate burning deck issues that require urgent action. But there is a massive opportunity when there's any change of government, but particularly when the change in government is from one party to another, to think long term, to face the big strategic issues facing the country, and to make sure that we answer those challenges and set this country up, not just to get back on its feet, but to thrive in the 21st century. And that long term approach is at the heart of the mission-driven approach to government that Keir set out.
Isn't that easier said than done when day to day you're going to be fighting fires and it's difficult to look to the long horizon when, to mix my metaphors, you're in the trenches kind of, fighting?
Yeah, but it's a discipline and you have to make those choices. And I've kind of already realised just, what are we, like 5 days in? It's Tuesday, right? That ultimately what government is about is making choices and recognising that there are always trade-offs, and government is ultimately about negotiating those trade-offs, making the right choices, and making sure that you make choices with a view not just to the next election, but to the next decade and the one beyond that. And I've got plenty of strong criticisms of the last government, but it was inevitable, I think, when Rishi Sunak became Prime Minister and when Victoria Atkins became the 5th Health Secretary that I faced in 2.5 years as Shadow Health and Social Care Secretary. It's inevitable that all they could do was just try and firefight and try and get to the election in a shape where they could say, oh, look, things are improving, don't risk the recovery. We know how that turned out. But as a result, everything about that government was short-termist, every single bit of it. And that has made the job that we now have even harder than it would have been if the general election had taken place at the same time that Rishi Sunak became Prime Minister. To govern is to choose, and not making a decision, not taking choices is in itself a decision. And we're going to pay a really heavy price for indecision.
So you've been there 4 or 5 days. Have you seen anything that has surprised you, or is it what you expected?
I don't know. I don't know if you can expect. I mean, there's like the personal, and then there's the sort of the professional and the political. I think what I've been mindful of since walking in bleary-eyed to the Department of Health and Social Care on 2 hours sleep on Friday afternoon was a recognition that both within the department itself and across the whole health and social care ecosystem, what they've had is a hell of a lot of instability. And just moving from one health secretary to another, one set of ministers to another, breeds instability and indecision, and it's hard to get things done. And these are people who, not too long ago now, we forget, also took this country through a deadly pandemic. And they have lacked direction, they've lacked leadership, they've lacked a recognition of the pain that they've endured. And I think there is, again, an opportunity to, for an incoming government to recognise all of those things, but also to lift people's sights to the horizon and make people excited again about the future.
I mean, I don't want to kind of, we've got you here, and I'm so much more interested to hear about how you see the future of healthcare than, you know, what the Conservatives did. That feels like an argument that was kind of hammered out in the election campaign itself.
Yeah, but just to say I mean, I'm sure we'll put this up on your podcast as well, but we're not going to let them forget. They're absolutely not going to let them forget the damage they've done to our country.
I'm sure you're not. But you have been unusual in, when you were Shadow Health Secretary, for talking about how the NHS was not the envy of the world. You've said it's broke. So the question is, how are you going to fix it?
So I'll say two things, and particularly off the back of the discussion we've just heard, but also Rachel's speech yesterday as Chancellor on economic growth. One of the things I've said to my department and to the NHS is we need to rethink our role in government and in our country at large. This is no longer simply a public services department. This is an economic growth department. And the health of the nation and the health of the economy are inexplicably linked. And that means we're going to be a government that firstly recognises that fact and recognises that as we get people not just back to health, but back to work, that's a big contribution to growth when there are 3 million people who are off work, off sick. That as we focus with a bold agenda on public health and prevention, and we just heard about the potential there, we will not only be enabling people to live well and to live well for longer, but to contribute more and to drive the economic growth of the country. Secondly, if we can marry our health and social care system with the incredible life sciences and medtech ecosystem we have in this country, we can be a powerhouse for the life sciences and medtech revolution here in this country. That is and in the world, and that is an economic growth mission. And thirdly, I'm now responsible for one of the largest workforces in the entire world that have a presence in every community in this country. As anchor institutions, the NHS, the social care system, we can be drivers of economic growth in every part of the country when we've set out as our #1 mission for government, not just faster growth, but equitable growth and prosperity shared by all. So, and that is a major shift in mindset. It's a rethinking of the role of the department. And it also means, and the tough messages I delivered in opposition are not going to change now we're in government. It also means ending the begging bowl culture, where the only interaction the Treasury has with the Department of Health and Social Care is we need more money for X, Y, and Z. The starting point has got to be, we will help you achieve your mission for growth and improve the prosperity and lives of everyone in this country by making sure that we are with you lockstep in driving growth. That is a big shift in mindset and focus and activity, and that's going to be at the heart of our thinking about how we build a health and social care system fit for the 21st century.
I think that's a fascinating description, that you see the Department of Health as an economic growth department. What are the kind of the symbols along the way that you are succeeding that? Is it about just reducing waiting lists? Is it reducing time between, getting a GP appointment? What does success, how are you going to measure whether you're achieving that economic growth?
Well, there's certainly some important metrics and milestones for patients. And first and foremost, I am the patient's shop steward. The very first call I made on arrival in the department on Friday afternoon was to patient voices. We have got 7.6 million people on NHS waiting lists. They struggle to access a GP. More than 1 million people are on mental health waiting lists. They dial 999, uncertain if an ambulance is going to arrive. And even if they make it to the emergency department, they can't guarantee that they will be seen on time either. And so cutting waiting times is my focus, my immediate focus, and the #1 priority I have. But as I say, in pursuing that objective, we'll be contributing to economic growth as well. And it's important to keep both of those things in mind. We will be embarking on a long-term plan for both health and social care. And again, that is really important when the pull is always on to the burning deck issues, and there are plenty. And I've just listed a whole load of them there in terms of weights and the consequences for people. But we've got to make sure that we keep our eyes on the long-term horizon, because if you look not just at the challenge today, which are bad enough, but the challenges which I consider to be existential for the future of the NHS, which are, growing aging population, rising preventable chronic disease, and rising cost pressures, because lots of this new technology and lots of this new science comes at a price. If we don't make the right reform decisions now, in the medium term, let alone the long term, future generations and future health and social care secretaries will curse us because we didn't take the difficult long-term decisions at the right time, and we saddled future generations with a national health service that is unsustainable. I am optimistic about the future of the NHS, and I think that the same equitable principles upon which it was founded in 1948 can and must survive and thrive in the 21st century, but that is not inevitable. And the anxiety that the public feel, the palpable anxiety I found on the doorstep during the election about whether or not the NHS will survive, is a legitimate concern. And it is why we have to act not just to address the immediate burning deck issues, but also the long-term strategic challenges, threats, and also opportunities that face the NHS in the 21st century.
Is it a false binary to talk about the private sector and the public sector? Do you work with the private sector to deliver healthcare? Is there any contradiction there?
Only if you're using Elon Musk's platform to complain that I want to privatise the NHS. Irony rolled over and died. No, look, there's just an obvious mutual interest, and it is not a reductive interest where private healthcare wants to accumulate profit, as businesses tend to want to do. And it's not just about the private sector's role in reducing the elective backlog, by the way, either. This is about a mutual relationship where if you can marry the sharpest, brightest mind in UK life sciences and medtech with the single payer NHS model that we have, with all of the untapped potential that it offers, the sky's the limit in terms of what this country can deliver for patients. And by the way, this isn't about, jam tomorrow and just about the long term. If you look at some of Labour's first steps in our manifesto, doubling the number of CT and MRI scanners, and not just more scanners, but AI-enabled scanners, those are massive productivity gains. Those are massive improvements for patient experience in terms of how many people we can get through and how quickly. They're massive improvements in the quality of diagnostics. And that's technology that exists today, not even the really revolutionary stuff that's hurtling down the track towards us. And yet, when I launched an initiative before the general election in opposition called Get Rid of Stupid Stuff, which was based on something they did really well at Singapore General Hospital, I was inundated with emails from people working in the system because, by the way, it is a total misrepresentation that they are averse to change or reform. They are crying out for it. And in my inbox were example after example, the 7 passwords that are needed to log in to deal with a single patient, trying to turn on the machine in the morning and just praying that it warms up and turns on. The lack of join up in patients' experiences that mean that, as Keir and I found when we were at Alder Hey before the election, a family whose baby's life had been saved with a heart transplant, having to go through not just the inconvenience of having to explain their child's experience to medical professionals who did not have full sight of their patient record, but to go through the fear and the anxiety. If you don't know my baby's experience, why should I trust you to provide good quality care? And those are the basic failures. And the final thing I'd say, John, and it's not a criticism of your profession, though it slightly is, and it's definitely not a criticism of Nick Robinson, who I think is brilliant, but that interview with Tony on the Today programme this morning, where Nick basically said, well, that's all very well and good, but what about these immediate urgent challenges? Those challenges are important, but we cannot keep on being drawn straight back into the immediate, the firefighting. You've got to think long term.
I want to ask you a long term question then. I know you went to Australia and you looked at the kind of health arrangements there, and it's a very different system to what we have here. I mean, you know, there people can pay a bit to top up the kind of primary health care they get with a GP or whatever it happens to be. You admired so much of what they did. Do we need to have to keep free at the point of use throughout the NHS, or is that something that if it delivered better results could be looked at as well?
Well, I'll say two things. Firstly, free at the point of use is about fairness and equity and defending a system that means when you fall ill, you do not have to worry about the bill. And I think that is an equitable principle that is worth fighting for. And the second thing I'd say is, however, people are already making the choice. And what we're seeing is the opening up of a two-tier system where those who can afford it are paying to go private and those who can't are being left behind. And one of the reasons I was determined in opposition to take on the left on this issue is this isn't simply a pragmatic argument that says, well, we can get waiting lists down faster if we use spare capacity in the private sector, though that's important. It was also a principled argument that said, why should those without means wait longer while those who have means are seen faster? That's an affront to my left-wing principles. I don't know why it isn't an affront to theirs.
Okay, I want to rattle through because we've got 3 minutes, 15 seconds left. Some of the kind of fire on the deck issues. Junior doctors pay? Where are we?
I'm seeing the junior doctors this afternoon. They're coming into the Department of Health. I know they're coming in not just from my diary, but from the army of cameras and journalists currently stationed outside the department.
Are you optimistic?
Optimistic, yes. Look, this is an important reset moment, I think, in the relationship between junior doctors and their government. And in opposition, we were very clear that the headline 35% pay demand is not one that we could afford, and that has not changed since the general election. The reason we were so blunt in opposition wasn't simply about delivering a tough message, but about showing them the respect I think they are due. And a key ingredient of respect is honesty. Secondly, beyond pay, there are a whole range of issues about how junior doctors are treated by their employer, which I am genuinely angry about, in terms of their placements, their rotations. I mean, the most egregious case I saw reported was a junior doctor whose wife had, I think partner had cancer. They had 2 kids, and there was no flexibility shown in where that family was placed, despite the obvious challenges of treatment and the obvious challenges of care. And when there was a public outcry, lo and behold, the situation was resolved. That is not an employer that is treating their staff well. So I think there are lots of issues we can make progress on.
Primary care, reducing waiting lists waiting times before you see a GP. I've heard so many health secretaries say we're going to prioritise this and nothing really ever changes.
Well, I remember Tony Blair being on Question Time before a general election, one of the leaders' debates, and people were having a go at him because they were forced, can you imagine this, forced to see a GP within 48 hours, and they were outraged they couldn't book further ahead. And I don't think he's apologised for that yet, by the way. And it was so funny. We did a clip on this for the Labour Party campaign. What a lovely problem to have. But it shows it can be done. And I think one of the things about Labour in government is, firstly, we did it before, and with support of the system and the country, we can do it again. And I really believe that. The second thing is, Conservative politicians are now conceding publicly what many have been saying privately for a long time, which is, just as only Nixon could go to China, only Labour can reform the National Health Service. Labour's DNA is in the NHS, and the NHS's values run through the Labour Party. Our love for the NHS is not in doubt, but sometimes if you love someone, You have to force them to change. And reassuringly, there is time for tough love. Reassuringly, 2.5 years ago, when I started out as Shadow Health and Social Care Secretary, these messages were really hard for people to hear and were greeted with anxiety and resistance. Because I think people, when they hear reform, I could almost hear more than 1 million spines shiver in the NHS workforce, conjuring up images of Andrew Lansley in a top-down reorganisation. I think the more that people have heard what Labour's reform agenda looks like, the more excited people in the system are. Because this isn't about changing structures and renaming integrated care boards or reconstituting trusts or changing the name of the chief executive of NHS England. What a waste of time those things would be. This is about the 3 big shifts that are essential for our health and social care system to thrive in the 21st century. A shift in the centre of gravity out of hospital into the community, primary care, community services, mental health, social care. It's about a shift from a service that's overly focused on treating sickness to a cross-government, cross-society focus on preventing illness in the first place. And thirdly, it is a shift from an analogue system that still has too many pagers and fax machines to one that is not only benefiting from, but driving the life sciences and medtech revolution here and internationally. We did it before in terms of saving the NHS. I feel more confident than ever that we can do it again. It will require a team effort. And wherever I go in health and social care, whoever I meet, I see a team of people that are ready and willing to put their shoulder to the wheel to get it done. And their government is already at work putting our shoulders to the wheel too.
Ladies and gentlemen, Wes Streeting.
Thank you very much.